Pancreatitis. The pancreas, sometimes known as the pancreas, is a gland found behind the stomach, next to the duodenum, that is responsible for the following functions. The small intestine secretes potent digestive enzymes that aid in the digestion of carbohydrates, proteins, and lipids. Secretion into the bloodstream of the hormones insulin, and glucagon, which are important for digesting sugars in the bloodstream and regulating the process of storing food in the body before using it to produce energy. The pancreas could be injured as a result of the immune system attacking pancreatic tissue, causing inflammation. Pancreatitis is divided into two categories, acute and chronic. Pancreatitis acute. Acute pancreatitis develops over a short period of time for a variety of reasons, including the following: gallstones forming in the gallbladder, excessive alcoholic beverage consumption, taking certain medications, infections are a risk, an imbalance in the body's metabolic processes, metabolism, go through surgery. Pancreatitis chronica. Chronic pancreas inflammation is common following acute pancreatitis or as a result of chronic pancreatitis. More than 70% of instances of chronic pancreatitis are caused by excessive and long-term intake of alcoholic beverages, and may also be caused by metabolic abnormalities. Pancreatitis symptoms. Pancreatitis can cause the following symptoms: severe tingling pain in the upper abdomen and areas of the back that gets worse when you eat fatty foods, abdominal bloating and sensitivity, vomiting and feeling nauseous, fever, increased heart rate, tachycardia. Pancreatitis causes and risk factors. The following are the many types of pancreatitis and their causes. 1. Acute pancreatitis causes. The actual origin of infection in most cases of acute pancreatitis is unknown, although the following are possible causes. Gallbladder stones are present. Excessive alcoholic beverage consumption. Taking certain medications. Lipid imbalance in the blood. Suffering from an infection. Go through surgery. 2. Chronic pancreatitis causes. It contains the following items: long-term excessive intake of alcoholic beverages, imbalances in the metabolic process, infection history in the family. 3. Factors that raise your chances of getting chronic pancreatitis. Many variables can raise your chances of having chronic pancreatitis, including the following: long-term excessive intake of alcoholic beverages. Gender. Men, especially those over the age of 35 to 40, are more prone than women to develop chronic pancreatitis. Pancreatitis complications. Pancreatitis can lead to a variety of problems, including the following: there is an infection, kidney disease, difficulty breathing, diabetes. Pancreatitis diagnosis. Pancreatitis is diagnosed using a variety of assays, including the following: an examination of the pancreas function, GTT, glucose tolerance test, imaging with ultrasound, CT stands for computed tomography, gallbladder and pancreatic duct endoscopy. Use endoscopic ultrasonography. Treatment for pancreatitis. The following are the many ways to treat pancreatitis depending on its type. 1. Acute pancreatitis treatment. Acute pancreatitis is treated in a hospital setting. In addition to painkillers, the patient is given medications by intravenous infusion at first. Acute pancreatitis requires treatment in the intensive care unit in 20% of cases. Because severe pancreatitis can harm the heart, lungs, and kidneys, instruments are available in the intensive care unit to monitor and constantly monitor the patient during treatment. The inflammation diminishes and the pancreas returns to normal after an acute incident of pancreatitis lasts only a few days. Pancreatic tissue destruction and death, pancreatic necrosis, can occur in severe cases of acute pancreatitis. In this situation, surgery to remove the damaged tissue may be required. The following is the most crucial information. The procedure can be done using laparoscopy or another minimally invasive approach. Small incisions are made in the abdominal cavity during laparoscopic surgery. A laparoscope is a surgical instrument that is introduced into the abdominal cavity. It is connected to a monitor inside the operation room. Images of the patient's internal organs are displayed on the screen when the endoscope is placed into the patient's abdomen, and the doctor then performs the proper surgery. One of the most significant advantages of laparoscopic surgery is that it is only necessary to open small wounds, reducing the risk of infection, pain, and scarring, as well as allowing the patient to recover faster and in a shorter amount of time. 2. Chronic pancreatitis treatment. The doctor tries to relieve the patient's pain caused by inflammation, as well as improve the disturbance in the patient's metabolic processes, which may be the source of the pancreas improper functioning, where the patient is given a set of treatments that includes pancreatic enzymes and the hormone insulin in case the pancreas is unable to secrete insulin. Pancreatic enzymes are given as pills to be taken with food to help in digestion. It is normally recommended to have a low-fat diet in order to absorb nutrients. Surgical treatment can help relieve abdominal discomfort and lessen the number of pain bouts that the patient experiences. Patients must avoid alcoholic beverages and adhere to the doctor's and dietitian's treatment advice, as well as be cautious and continue to take the essential drugs to lessen the severity of pain episodes produced by inflammation. Pancreatitis prevention. Because excessive alcoholic beverage consumption is the leading cause of pancreatitis, limiting or entirely avoiding it is one of the most significant ways to avoid infection with this type of infection. People who are addicted to alcoholic beverages can seek therapy from their treating physician and visit treatment clinics for those who are addicted to alcoholic beverages.